My name is Dr. Oliver Kisaka. I serve as Managing Director of CORAT Africa. We appreciate very much the grace of God that has been upon us as an institution, which was set up in 1975 to support churches and church-related organizations in matters of management, administration, finance, human resource development, and project work. Church hospitals are some of the most precious institutions available in any part of Africa, for the simple reason that churches are in extremely remote places, many times places that are not reached by government services. And so for very many people who live in difficult circumstances, the church hospital is their most immediate medical health facility. Churches also run this hospital from more of a charity approach rather than a business approach. And because of that, they find it difficult to fund some of their work. And so being a critical institution involved in capacity building among churches and church-related institutions, we felt we should generate a course called Diploma in Health Systems Management, which would then create an opportunity for those who serve in mission health facilities.
I joined this course of health system management because it was an opportunity for me, because at my workplace I'm in the leadership position. I work with management, and it was an opportunity for me to learn how to do things right.
I took up this course because I am at a managerial level in my facility, and I felt that it was going to add more value to me as a health systems manager and help me integrate well with the other departments in the hospital. My background is in finance, and I felt that I needed more skills that would enhance my knowledge in the whole scope of a medical facility.
I chose to join this course because I was interested in learning more about health systems, given that I'm working in a hospital setup, and my initial background training was not directly in healthcare. I was trained in hospitality industry. It has really helped to build my confidence on the work that I do, because now I'm able to identify. I feel like I belong where I'm working, so I have the confidence to discharge my duties.
I was able to acquire a lot of skills, just to mention a few, on the side of changing the attitude of the employees in the facility, as we learned from Foundation of Life, or culture of change and behavior. And on the side of integration, it is a skill that is needed to apply in the management to make the facility to flourish smoothly. Because when you integrate the services that are required, or that we give the quality service to the society, I think it's a good skill which I have possessed from this training, and so many of them.
I would say the training has been one of the best I've had in my life. The kind of the knowledge I've acquired from this training is immense, and of course it has helped me in so many ways. One, I would say it has given me an opportunity even to meet so many people of different professions and share the knowledge together. Also, I'll say it has added something to my CV. Yeah, and there's an opportunity to even move to greater heights maybe in future, and I know it's something that will help me.
It has helped me greatly, and I've already brought some changes to members, especially for myself. least I have understood that everybody, even from the smallest position you are in, or even those you are working with, have a mission. And this mission is God-given, and it is upon each one of us to respect each other and to move on. So because the service or the mission of Christ must continue, and it is different for everybody.
The first cohort is just coming to an end, and their feedback is telling us they have learned a lot. We took time to visit the hospitals around the country where they come from. There was a lot of excitement in each of those hospitals. In some of those hospitals, the management was so appreciative of the course that they have called CORAT Africa to go and follow up with them on a particular area. In Maua Hospital, for example, they have conducted sessions for the entire staff team on culture and change management. As I speak to you now, there is another hospital that has requested us to take almost 1,000 of their staff through the culture change program. We'll be doing that for close to 25 days in the near future, maybe about 2 weeks from now. So these tell us about the importance and success of the course that we are doing. A great feature of the success is that the students who came to this program are now in their very last tail-end exercise. They are writing their final paper, and they are likely to graduate this year sometime in November.
I've had an opportunity when we were doing our practicum in the hospital setup. I had an opportunity of actually visiting each and every department, whereby as we interacted even with the members of the department throughout their work routine, the daily work routine, I was able actually to pick areas of improvements through the knowledge that I've acquired from the training, and actually point out areas that the hospital can actually improve on, areas that needed, let's say, interventions, and areas where I could be of help. On top of that, in my department, I was able also to do mentorship to quite a number of staff on areas that touches directly on healthcare financing. Me coming from a finance background, I was able actually to articulate better healthcare financing for better healthcare outcomes.
Through the experiences that I have had here, the lessons that I've had, I've been able to carry out a few changes, especially when it came to customer care, which cuts across in all departments, because every individual who works in the hospital handles a customer. Therefore, for me, I have instilled that, I have passed that to my colleagues, to know that every individual handles a customer, and a customer or a client is the source of our being there. So we have to handle the customer in a good way. It is no longer like managerial, like the work for the customer care only, but it is for everyone. So all operations that are done geared at assisting the customer.
My area of lecturing is in Christian foundations. Initially, when I start the course, because we are running the second cohort right now, when I start the course, a number of those who are in the class wonder, what does the Bible have to do with our management course? We came here to learn professional management, not theology. But with the time, they begin to realize that there is an amazing empowerment that comes when one appreciates that the service they are offering in administration and management, or even in medicine, is being guided by a sense of mission and purpose. respecting patients as people created in the image of God, respecting colleagues as people created in the image of God, serving them as if they are serving the Lord himself, then they begin to realize there's much more joy in service than just making money. And there was one student who said, when we began this course, I really had my doubts. But in the 4th, 5th session, he said, I now think this is perhaps the most important part of this course. So the integration between faith and practice is a unique part of this course, which I would tell anybody anywhere to choose to attend the CORAT course, because it is a course that is granting a bridge between the God that we love in worship and the professions that we love in the service of people within the hospital.
I have been able to apply the knowledge because most of the things we have been learning, I find them applying directly on the job that I do. I'm working in quality assurance department, where I find myself having to contribute to different departments in the hospital in terms of knowledge and input to the work that they do. So most of the courses have been very instrumental for me. For example, the course on information management and library, information competency and library, it has really helped me as I work on the SOPs, standard operating procedures. I'm able to do proper referencing and identify the documents in a better way. My document editing skills have also really improved tremendously. When it comes to issues of research, it has also helped me. I'm able to give evidence-based, to support my work with evidence, research-based evidence. I have already contributed to 2 research projects in the hospital, and I'm doing another one at the moment. When it comes to courses like quality management, it was also very direct to what I'm doing. I'm able to apply the different tools and concepts that I learned, like the root cause analysis, the fishbone tool. I'm using it to help solve problems within my organization.
What I've learned, I've transferred it to my workplace, and I've executed it to my fellow staff. And we have different committees or other meetings, and I happen to be in all these meetings. And like health HOD department, I've worked with my fellow leaders in departments to see how we can do our work best. We have started working improvement teams, which is led by all the HOD members, whereby we are able to identify our gaps in our departments. We are able to work on them, and we are able to do our reporting the right way. We are able to see what we can do at our level and what can be done by management. And with that, we've reduced gaps and most of the small mistakes we used to experience before. Also, what I've transferred into my workplace is that we are able to work together. I have learned how to solve conflicts. We are able to relate well, and I'm also transferring the information in terms of we are sharing the notes. I'm able to walk around and see what others are doing, and where I'm able to correct and give information why I'm doing that, I'm able to do so.
I have applied some of the skills I have learned. For instance, in our facility, we didn't have a maternity wing, and we realized the community needs that service. So with the skills I learned here, I was able to set up a maternity wing and equipped now. And we were able to bring the employees together. Before, there was a lot of issues, but with the skills we learned from culture change and behavior and foundation of life, at least now, the employees are very responsible. They can work in harmony.
There are a lot of things that I've learned at CORAT which I've already implemented at the place of work. One of them is we did a unit on supply chain management, and because of that training, I was able to go to the facility and we set up a drugs and therapeutic committee, which was able to establish an essential medicines list for the facility. We also did a unit on quality management, and because of that, I was able to put up a quality improvement team in the facility, which is working on quality in the facility. We also did a unit in human resource management, which has led me to come up with initiatives for staff motivation, recognition, and team building. And there are so many other things that we have learned in class, which have already started implementing in the place of work.
Having spoken to a number of the participants, I have had very good feedback. They have been very happy. First is they say that they have enjoyed the delivery of the training. The lecturers, the people who are teaching them had impacted them positively. So when they go back home, they are going to benefit a lot. Apart from that, CORAT being a Christian organization and training on the line of Christians, they have gone away with a spiritual kind of training, which is going to impact not only in their churches, in their organizations, but also on personal levels and also in their families. Last but more importantly is the fact that they have enjoyed their stay here. They have enjoyed the housekeeping services. They were received well at the reception when they checked in. They have also had an opportunity to interact with our chefs who had prepared very nice meals. They have had variety of meals every day. So they are going away with not only learning about HSM, but they have also learned about other aspects of hospitality.
I'm so grateful for the far they have brought me to, especially by the way they are organizing themselves to make sure that the lecturers have been called on board and they are scheduled accordingly. There is no day they will clash coming to classes, or there is no day they will miss classes because they are saying there is nobody who is teaching. But at least they have organized properly on this organization altogether, combining with the AIU and many teachers around the universities here. So I'm so grateful for CORAT Africa as a large, because they have given us that chance to pursue these studies in a very peaceful environment.
Being to me here was a blessing. Of course, I got to know CORAT Africa. I never used to know CORAT Africa before. And I also made a lot of friends from other facilities across the country. And they have been very helpful in helping me solve problems at the facility. Of course, I've also expanded my network with getting to know more of the facilitators of the course. I've also been able to grow as a person in new knowledge. Of course, I'm getting a new diploma in my CV. And I believe that what I'm getting here places me as a person of great value in the market and also in our facility where I'm working. And I believe that I'll be able to transform our facility. And I also wish to express my gratitude to CORAT Africa for thinking about this course, coming up with it, bringing us on board. And I believe that if the course is rolled out to many other people in the country, there'll be a great change in as far as health service is concerned.
CORAT is a very nice institution, and I must say thank you to them for having this plan to build the capacity building of every person who wants to, be somebody in the society. I thank them for making time for this program. Their patience, their accommodation, everything is nice. They are very friendly and are very much concerned for our growth. And I also extend my thanks to AIU, the lecturers, and all those who have helped us to possess these skills, which has not been there before.
This is a very critical course because we are talking about the improvement of the quality of services within the hospital system, as indeed we train people in other institutions within the church setting. We as CORAT Africa run as an institution. What we teach, we practice. And so we are teaching people what we have found practical and meaningful and useful here. And we believe that because of the way our staff approach their service with a Christian heart, with a loving heart, with a professional heart, the guests who come to this place go away with a positive testimony of the experience that they have had. The staff that work together hold one another in high regard with respect because of the God that they serve. We believe that this culture can also go to the hospital and that it will bring a very, very new experience in the way we service the people. So I'm telling anybody out there that this is an opportunity they would like to consider. They are welcome to the CORAT course. We are offering it both in physical presence and also virtually. Just find out from us what we need. We will be able to meet your need.